This is great. Yes, keep the energy going. But this is where I do need you to be quiet, though, okay? We have some important things to talk about here with these dynamic women. All right, ladies and gentlemen, it is my pleasure to introduce two incredible leaders for what will undoubtedly be a conversation full of education and also inspiration. Please welcome Dr. Rachel Brem and Sheryl Sandberg. For those of you in the room who don't know, Dr. Rachel Brem is professor and vice chair emeritus at the George Washington University and co-founder and chief medical officer of Brem Foundation to defeat breast cancer. She's an internationally recognized breast cancer physician, researcher, and advocate who is dedicated to advancing early detection and improving outcomes. Sheryl Sandberg, the founder of Lean In, supporting a global community of more than 138,000 Lean In circles in 183 countries dedicated to building a more equal world. Sheryl, absolutely. Sheryl previously served as Chief Operating Officer at Meta for 14 years. She is the best-selling author of Lean In and Option B, Facing Adversity, Building Resilience, and Finding Joy. Clap again. That says where you clap again. All right, thank you. All right, ladies, you ready? It's time to dive in. You ready? Okay. Sheryl, let me ask you first. Brem Foundation, first of all, is just thrilled to have you here as part of this incredible celebration, 2 decades of impact. I also know that breast cancer is a personal topic for you. You've written about your close relationship with your grandmother and her journey's impact on you. Can you share with our audience who may not know why this is important to you and how it's affected your life?
Yes, it is really an honor to be here sitting next to, in between 2 women I admire so much, and at a table with the great Debbie Wasserman Schultz, who I deeply admire as well. My grandmother, I was born on her birthday. I was exceptionally close to her. She had breast cancer in her 30s. So if she hadn't beaten breast cancer, I would never have known her. And she had an incredibly big impact on my life. It's an actually incredible story, and my brother is here. My brother went to medical school and wrote his medical school essay. It's an incredible story about my grandmother. I believe the story, come down through the ages, is that she was very early. She had a unilateral mastectomy, and she was never told that her lymph nodes were actually affected. Her husband knew, she never knew. She lived into her 80s.
Wow.
It's a really incredible story. My brother wrote his medical school essay on that moral decision that had been made the generations before us. But more relevant to tonight is the fact that she survived, and she survived because there was detection, and then she sold, this is a true story, fake watches out of her car in the condominiums in Florida, all for the Strax Breast Cancer Institute to pay for detection for women who couldn't afford it.
Wow.
So broke the law every which way by selling fake Rolexes for like
$20,
cause. But to pay for early detection. And so the opportunity to be here with you, and also with this woman who I admire so deeply, who has been such a leader on advocacy, on policy, on the right laws, but also the right opportunities for women, is just an honor for me and deeply personal.
Absolutely. Thank you for sharing that. You want to shout out? You said your brother's in the room. Can you wave? Right there. Where are you? Okay, there he is. All right. We want to acknowledge you as well. Rachel, we know that many people in the room tonight have heard your origin story, but there are some people who may not have heard it. And of course, this is where this all began. Can you remind the room how this particular issue became so defining in your life?
So thank you very much. Thank you, Sheryl, David, Congresswoman. I'm so grateful to be here with you today celebrating this incredible occasion. Everyone here has this breast cancer story. I know most of you, and everybody has a breast cancer story. So my story started when I was 12. My beautiful, vivacious 33-year-old mother, redhead, green eyes, disappeared, and she came back several weeks later, quite changed. And it was only months later that we found out that she had had breast cancer. She was told she had 6 months to live. She lived 44 years. So before I knew about early detection, I benefited from it. And then I decided at that point to go to medical school. I'm an immigrant. I was born in Israel in the 1970s and 80s. We didn't go to medical school, but my parents weren't too keen on the thought of me going to medical school, but I didn't want other 12-year-old girls to be impacted as our family was profoundly impacted. And then history repeats itself. When I was 37 and my oldest daughter was 12, I was trying out some ultrasound equipment and I found my own breast cancer. So the thing that happened that became so acutely obvious to me is that I knew what I needed and I knew what I wanted to do. And I realized that women are told this information, have to make these profound decisions and don't have that information. So that was really the nidus, the beginning of the need to inform and empower women, and the nidus for the Brem Foundation. So, it's making lemonade out of lemons, and I thank my mother every day for the passion and the guidance to be here tonight with you. She would be very proud if she were here.
Thank you for sharing your story. I think sometimes, things happen in our lives, and at the moment we don't understand, but that happened so this could happen. Right. So, Sheryl, we know that much of Brem Foundation's work is focused on educating women and how to advocate for their own breast health. I know that teaching women to self-advocate and to build leadership skills is central to your work. If you could share a little bit more about why that is such a priority and where you see progress and also where you see the remaining need.
So women became 50% of the college graduates in this country in 1981. We currently have 13% of the top jobs, if you define those as CEOs of big companies. You'd have to believe that men are, 13 times more talented than women to not believe something else was going on. So I'm going to choose to believe that something else is going on. And that something else is very simple, but something that's been true my whole life and is not changing, and really is not changing, which is that we celebrate leadership in men and not in women. I'm going to prove that. Ready? If you are a man in this room, raise your hand if you were called bossy as a little boy. There's maybe one hand. There's none tonight. If you were a woman, raise your hand if you were called bossy as a little girl. So I'm going to give everyone an assignment this weekend. Go to a local playground. If you stay not too long, you will hear a little girl called Bossy, probably by her own parents. You walk right up, you have a big smile, you say, "That little girl's not bossy. That little girl has executive leadership skills."
There you go. Right.
But ready? I'm going to say it the other way. That little boy has executive leadership skills. There's no humor, but there's a lot of humor to the girl. Why? Because humor surprises us, goes against our expectations. So as we're sitting here tonight, we all still have those same cultural expectations that leadership for female leadership is surprising and even funny, and male leadership is expected. And that translates directly to this work. Because if you look throughout the medical profession, we were just talking about that. So I have 8 stories. Everyone here has 8. It has been so dominated by research on men, so dominated by the needs of men and not of women, that we are going to have to advocate. But since everyone doesn't know how to advocate or have the knowledge and expertise, that's why Dr. Rachel Brem's leadership matters so much, because I'm sitting next to a woman who has shown all of us that that knowledge can be used not just for herself, but for so many others. And that advocacy, she is working, and all of you are. I'm so grateful for your support for the Brem Foundation to turn that into advocacy for women.
Let's talk a little bit more about the self-advocacy as it relates to breast health, Rachel. What is most important for women to know in playing an active role when they maximize their chances to catch breast cancer early? How might they push back or even speak up for themselves? How do they do a better job of advocating?
First of all, the incidence of breast cancer in young women is skyrocketing. And so often women go to physicians and say, I feel something, and they're told they're too young to have breast cancer. And then they come to me, 2 young children in tow with metastatic disease. And it's a tragedy because we are taught to be good girls, speaking to what you said. And, forgive me for in mixed company, but we at the Brem Foundation really believe in being badass girls because you've got to raise your voice and advocate for yourself. And, even as a physician, we're well-trained and well-meaning, but we make mistakes. We're human, and nobody knows you as well as you know you. So we advocate to empower yourselves and go seek a second opinion. The other thing is we know that women with dense breasts need additional screening, and so often it's not approved initially by insurances. We don't teach women to get on the phone and advocate and fight with their insurance companies to get their life-saving tests. And also we need to advocate now, we're integrating so many new technologies. Women have to educate themselves to understand where they can find the best opportunities for health, wellness, and cure, and advocate for themselves for that. So raising your voice in all of health, medicine, and especially in breast cancer is truly life-saving.
Can I ask you real quick? So we can say advocate, but there are a lot of times where people are in that doctor's office or where they're being screened, and it's intimidating for some people. What do you say to the people who are like, I'm concerned, they're...
Right. How many times all the doctors in the room here, they say, I don't want to bother you, or I don't want to ask, or how can a doctor be wrong? Well, let me assure you that doctors can be wrong. And it's really education. It's learning that executive skills are important and raising your voice is important. You're not being a bad girl, you're being a powerful self-advocate for life. So we have to educate young women, starting with our Young Advisory Council. We realize we have to reach the young so that they understand that they can be right, their doctor can be wrong, and that they are an integral part to their health and life.
Okay, use your voice, speak up.
Use your voice.
All right, let's shift the conversation a little bit and talk about something I know both of you care about, and we've been hearing a lot about in our world. Advances in technology, AI specifically, have created opportunities to improve women's health and well-being on a systemic level. It's also, though, opening up some dangers for potential inequities. Sheryl, if you could tell us about your current efforts to level that playing field with the use of AI.
This is what my foundation, the Lean In Foundation, is now very focused on, which is that we have new technology, but it reinforces old patterns. So you see the bias in the technology, but you also see the bias in the way people are using the technology. Recent data we just surveyed and put out is that 22% of women are using, 22% fewer women than men are using AI daily or constantly in their jobs. And this is important, managers are encouraging men to use it more than women. When you have a male and a female coder using AI, and the boss finds out that AI was used, the boss thinks the man is more competent and the woman is less. Judy Lichtman is here. She will tell you this is the old pattern, same old data, same old pattern being applied to new things. And so that's really dangerous. And so we are trying to make sure that women become users of AI and women also become designers of AI. Women have 29% of the AI-related jobs and 14% of those leadership jobs.
Wow.
We have a ways to go.
We do have a ways to go. Rachel, I know we've heard plenty on the news about the use of AI when it comes to breast imaging. I know you talk a lot about this. We've done interviews about this. How is AI being used, and what role do you see it playing in breast cancer outcomes?
I am very excited about the use of AI to help level the playing field in healthcare disparities. It turns out that underserved communities have most of their breast imaging read by general radiologists who we know don't perform as well. But studies have now shown that general radiologists can perform as well as subspecialized radiologists with the use of AI. So we can use that to integrate in communities where we don't have enough resources. Early detection saves lives. We can cure essentially all breast cancers if we found them all early. And we know with AI, it sees things we don't and can find breast cancer up to 5 years earlier. So I'm proud to have been part of a team that helped develop the AI product that's used commercially as a second reader in Europe. It's in 600 places around the world. And I really believe that we'll be able to find, we do every day, find earlier, more curable breast cancers with the integration of AI, the responsible integration of AI, and help level the playing field, not only in underserved community, but in the military, which is actually an underserved health community because of the lack of subspecialized physicians in the military.
Wow, I did not know that. Okay. Rachel, I know at Brem Foundation, your education programs have always tried to reach as many women as possible. And one common through line has been in the workplace. Well, this is an effective place to reach people. What role can employers play in advancing education and providing essential care?
Well, I want to say that we really learned a lot from the Lean In Foundation about this, that you have to find people where they are. Women are responsible for the healthcare for their families, but they're always the last on the list. And if you ask them to go elsewhere, it doesn't happen. But if you reach them in their workplace and make it a positive as opposed to a negative, that you're not at work, but that you're optimizing the opportunity to keep your skills in the workforce, that's a really critical thing. So Brem Foundation is now really focusing on workplace collaborations to optimize the detection of early curable breast cancer.
Certainly important. Sheryl, talk about the workplace and prioritizing health and wellness. We know, what role do you think that employers can play in making sure health is a priority? And what have you seen that's succeeded so far in creating healthier outcomes?
I mean, I've spent a lot of my career managing companies, but also putting in the benefits that I thought mattered. And it's always looks obvious from later on, but it isn't. One of the most interesting things that ever happened to me actually is a breast cancer story. There was a woman, she was working in my office when I was at Facebook, then Facebook, now Meta, and she had breast cancer. And I asked her, are you going to be okay? And she said, yes, I'm going to be okay, but I will never have children. And I said, why won't you have children? I don't even know if this is medically correct, but this is definitely what she told me. She said once she went through the radiation and the chemo, that she didn't think she would be able to have children safely. And she needed to freeze her eggs, but she couldn't afford it. And so I went to our head of HR, a woman, and I said, we should pay for egg freezing for women with cancer. And she said, we should pay for egg freezing for everyone. So we rolled out what was... I believe, the first big company to offer this as a benefit. You can go look it up. Go home, and if you have better things to do, but if you have nothing better to do tonight, look up Sheryl Sandberg egg freezing, and what you will see is like a torrent of criticism. Like it was unbelievable. Like you would think, I mean, Tucker Carlson was out there saying that I was telling women not to have kids and to freeze their eggs. Like Sheryl Sandberg is so dedicated to women leaning in that she doesn't want anyone to give birth naturally. I'm like, none of that's true. It got so bad that I had to go to an internal Facebook meeting with 1,000 people, and I was like, okay, I like the raise your hand trick. Raise your hand if your manager has told you not to have kids and to freeze your eggs. No hands.
No, right.
But now all the tech companies, and I think a lot of big companies, this is a basic benefit they offer. And that's a really important thing. And it is a moment of thinking about what opportunities and responsibilities do workplaces have to take care of women. And I think the broader we can be, believing that workplaces have that responsibility, the better our outcomes will be.
It would be great to see more companies and workplaces.
Can I say something about
Absolutely.
that? It's when a woman is diagnosed with breast cancer, there are so many difficult decisions she has to make, right? If you have strep throat, you take an antibiotic. If you have a broken bone, you get a cast. If you have breast cancer, do you want a lumpectomy? Do you want a mastectomy? I don't want any of it. There's so many difficult decisions. And I've seen so many young women who didn't even know where to go to get coverage for freezing eggs. So I just want to say how grateful I am from the breast cancer community that one more difficult, profound, life-altering decision has really been simplified by your leadership. Yet one more thing, really, it's a big thing. And as women are more impactful in the workforce, and are older when they're having children, this is not a small issue. So thank you for that. I don't even, from the patient perspective, you can't imagine how much comfort you've given to people at a time when they're making all these decisions. And not having children, if you want them, is not a small thing. So thank you for that.
That is huge, absolutely. Clearly, you are both trailblazers and pioneers in your field. Sheryl, an executive in the tech industry and philanthropy. Rachel, you've charted a course for women leaders in breast imaging and health technology. When you look back at the path, what do you most want to say to women who are working on their path to leadership? Sheryl, I'll start with you.
I mean, I want to tell them to lean in. I want to tell them to want to be leaders. Because what we're seeing now for the first time in our data is an ambition gap for women. You know, we do surveys, we ask women and men at the same level, do you want to be promoted? And it's hard to measure ambition, what that is, but that's like a nice, clean, simple question. And for the first time this year, in the 13 years we've done this data, more men than women want to be promoted. And given that we already have so few of the top jobs, that is not a really important thing. And I think one of the reasons women don't want those jobs is I think mistakenly, that it's incompatible with having children. Sure. Again, something we do to women, not men. I'm going to do my hand raising thing again. Bear with me. Men, raise your hand if any time in your career someone said, are you sure you want to do that? Don't you want kids? I've never seen a hand.
Wait, there's one hand. Okay.
There's one. That's great.
Right.
That's my son-in-law.
Are you sure you want kids? Women, raise your hand if someone has said to you, are you sure you want to do that? Don't you want kids? We are told over and over and over, the language having it all is only applied to women. Having it all has a clear meaning. Having it all means having a career and a family. Most women have to work. Right. Most women absolutely have to work to support their families. Telling them that they can't have it all, meaning do both, something we assume men can be, is cruel. And so I think we have to close the leadership gap by making sure that we don't systematically discriminate against women in leadership roles.
That was powerful. Thank you. Rachel, you want to answer that?
I want to say lean in. That's really what I want to say. And I would tell young women as they're coming up, your life is not going to be easier if you're not in leadership position. Your life will be easier if you are in leadership positions, because you can be the decision maker and not the one that has to accept what other people are telling you to do, which is the harder of the two. So, and you know, I just want to say, I feel so privileged, so honored to be on this stage with Sheryl Sandberg, one of the most influential women on earth. And within the first 5 minutes, she talked to me about her daughter. And I just want to point out that we have 2 tables here, one of my children, my daughters and their husbands, and one of my grandchildren. So they're the little people in the center. So you can do it all. Don't believe that you can't. You can do it. We have Congresswoman Debbie Wasserman Schultz, her chief of staff, Ashley Jones. I mean, it's time and time again. So follow the women who have done it. It's easier to lead than to follow, and pursue your dreams.
I love that. I love that. I feel like I could sit up here and we could talk a lot longer, but we can't. But because I have so many questions that I want to ask you about everything. As we wrap up our conversation, I do want to ask each of you to give one sort of main thought as it comes to advocating, self-advocating, and prioritizing your health. Sheryl, let me start with you.
I mean, knowledge and access. And this foundation does both. Again, honored to be sitting with you.
Thank you. And I'd say, don't worry about bothering people. You have to advocate for yourself. That is an endless requirement.
I love it. Thank you both so much. I mean, I know you guys all have questions, but this is not the time you get to ask them. Thank you guys so much. That was amazing. You've given us some really, really important takeaways. Ladies and gentlemen, please give it up for these 2 incredible women, Sheryl Sandberg, Dr. Rachel Brem. Thank you guys so much.